Tanisha, and I am originally from New Jersey, but I currently live in Delaware. I am a 47-year-old female, and for years I've had issues with heavy bleeding, severe cramps, really huge blood clots, and it just has totally taken over my life to the point where I couldn't go to work and feel comfortable being at work without knowing that I would have to literally go to the restroom and change my tampon like every hour. My period was coming back heavier than usual. The pains were coming again. And I was just like, I don't know what to do. This is so bad. And then I started experiencing those sciatica pains, like down my hip and my legs. My lower back was just, oh, it was horrendous. And it was really crippling. It was debilitating. And that was the first experience that I had with those kinds of pains, in addition with the regular cramping. And then also, I noticed that when I started driving to work on the highways, I would get motion sickness. Like I've never had motion sickness before when I'm actually the driver. And so that freaked me out. I'm like, why am I getting sick? There's no reason for me to be pregnant because I'm not doing anything to get pregnant. And I didn't eat anything out of the ordinary. So what is it? And then that's when I went back to my surgeon who did the myomectomy a few years ago, and they had me go get an MRI for my pelvic area. And so I did that. And then they came back to me and they told me that I had a few fibroids, which really wasn't that big of a deal, but also they are seeing adenomyosis in the uterus. And that was back in December 2024, the end of December. I had no idea what that condition was, never heard of it in my life. So I was in that office and they said the H word. Like that's the biggest cuss word I could ever hear at this time in my life. And I totally freaked out and was crying. And I'm just like, that doesn't make any sense. Why? There has to be something else you can do to preserve my uterus so that I could have a child or so that I could, still be able to work with the fertility specialist with the eggs and get all the stuff done. And they're just like, yeah, we have to do this. Thank God I never called them again because I really think that's a scam. And it really makes me feel bad because I'm assuming some of the women that were on their Instagram account were maybe actresses just saying the things for the doctor. But I'm quite sure people have gotten scammed because of that because it just doesn't make sense to me. Who knows? Maybe it is a legit business, but I didn't go to them. So I'm still on my pursuit for in Google trying to find a great surgeon. And I came across CIGC. Now, understand, looking at their website, I was completely amazed and I felt so much better because I'm like, this is legit, legit. Oh, they take insurance? Oh, okay. Oh, not only do they take insurance, but they have the whole entire breakdown of different conditions that women go through. Not just that, but the treatments that they will give for you and so many other things. And there's women from other places in the country traveling far to come to this practice, and they have numerous locations. I think I need to check them out. And so that's when I called and had a consult. I was able to be seen really, really quickly, and I was so surprised by that. And then I wound up going home 2 days later and didn't have any pain. I only had to take one ibuprofen. So that just shows you how great of a surgery that was. And told me that, you know, I'll be, it's a recovery, probably like 5 days, And I couldn't believe it because I had a bikini line cut and I had a little tiny like inch of and that was like an inch or so. And he went through the belly button and they went through the belly button with the myomectomy last time, but it was robotic. So it was so much more involved and just horrible and a bigger, I don't know what you want to call it, bigger incision or what have you. But this time I barely noticed. Like my belly button looks pretty again, and it's only been a month out, and I'm just like, I don't even feel it. My bikini line feels good. If anything, I was scared about that because I've never been cut in the bikini before. But I'm chilling right now. I'm saying this all to say, if you have an issue with heavy bleeding, severe cramping, the back pains, you feel nauseated, bad moods, all that kind of stuff, go to CIGC and get it checked out. They will take care of you. Make sure you go to them because, like they say, they are the hyper specialists. They are the experts in this field. They aren't just regular OBGYNs, GYNs thinking they know what they're doing and telling you to go get a hysterectomy because they want to open you up again, right? No. CIGC is the practice that's really going to take you first. They're going to consider you first and literally actively listen to the patient on what it is that's going on with us so they can determine options. And then we'll go from there, right? And on top of that, they care. Like it wasn't when I had my consult with Dr. MacKoul, it wasn't one of those consults where it was just like, okay, what's the problem? Blah, blah, blah. He was really into like what I'm saying. And this dude's been doing this for a lot of years. So I'm quite sure he's heard plenty of stories before, but I felt like I was his first patient, and it was his first time with a patient. But if he treated me like that, he's going to treat you all like that too.